you're not informed,
If you don't know where you come from, you will never find where you're going.
When Nigeria is working, we will all know.
PDP and us are diametrically opposed.
SaharaTV, TV, the best TV, information, education, inspiration. SaharaTV,
I am from SaharaTV. I'd like to ask you a few questions.
Education, inspiration. SaharaTV, they get mouth, they get mouth.
Hi viewers, welcome back to SaharaTV. My name is Adiola Fayong and this is our highlight segment, and today we want to highlight a problem that is really troubling us in Nigeria and to discuss it, and it's none other than maternal death. Right now, an NGO named as Save the Children in Nigeria has revealed that Nigeria now records the second highest number of maternal deaths in the world. Now, with an alarming death rate of 144 women dying every day and 10 women dying every minute in Nigeria, we now have the greatest numbers of preterm births in the world due to population. That's according to Save the Children. And also, Nigeria is a country with the second highest maternal death in the whole world. And a few weeks ago, Nigeria was named the worst place to be born in 2013. How sad. So, with me to discuss this issue of maternal death in Nigeria are two doctors. The first doctor is Dr. Joseph Adinma. He's a professor at the Department of Obstetrics and Gynecology at the Nnamdi Azikiwe University in Nigeria, as well as Dr. Dorothy Ogundu, who practices obstetrics and gynecology at her own medical center here in New York. It's known as Aki Life Health Center. Dr. Joseph Adinma and Dr. Ogundu, welcome to SaharaTV.
Thank you for having me.
Thank you very much. Thank you.
Great. Okay, so let me start with you, Dr. Joseph. Why is it that Nigeria is now has the second highest maternal death in the world? What is going on?
Well, there are so many factors, factors that have to do with both medical and non-medical factors, and factors that have to do with health systems, and factors that have to do with practices that are cultural, social, economic, religious, factors that have to do with reproductive health. These are mostly the non-medical factors, factors that have to do with access to emergency obstetrics care, causing delays in access to emergency obstetrics care. We've been able to identify primary level delay, secondary level delay, and tertiary level delay. Primary level delay has to do with problems associated with recognizing the presence of obstetric emergency and reacting to that. In many places, you have a traditional birth attendants who may not recognize the basic signs and symptoms of obstetric emergencies. So by the time they recognize and react, it might have become too late. There are also cultural impediments. Patriarchy is a major issue, in that in many parts of the country, especially in the northern part of the country, the woman cannot go to the hospital except when she has been able to obtain permission from the husband or from a male elder. So that can cause primary delay. Secondary delay is related to reaching to the health facility for emergency obstetric care. Reaching, that is to say, we're talking about transportation, bad roads, which of course we know is could be a government problem. Bad roads, transportation, and all that. And tertiary delay has to do with problems arising from the health facility. It could be the problem of non-availability of blood. It could be the problem of the poor attitude to work of the health staff. It could also be problem related to lack of the available drugs and equipment. These are the major factors that I think that we need to combat in order to reduce maternal mortality in Nigeria.
Thank you, Dr. Adinma, for bringing up all these points. Apparently, every little thing counts. Dr. Ogundu, you've practiced in Nigeria and you also practice here in the US. I'm wondering, should Nigeria still be having all these problems that are causing this maternal death in 2013, being the giant of Africa, so to say, when other smaller countries are doing better in terms of their maternal death rate? What do you have to say about this, Dr. Ogundu?
Well, I listened to the factors that the good doctor has elaborated on, and I have the unfairness of having, actually I was trained here and I did all my education here, and including from university to medical school. But I've had the opportunity to work in different parts of Sahel, you know, in Africa, Sub-Sahara Africa, and Asia as well, as I run around doing health ministry, and all in women field. There is a program we call SOSAN, which is Save a Woman, Save a Nation. And what he's saying, I agree with, but at the same time, I've seen countries that are worse off than Nigeria that have not as much, you know, money. And I personally, I'm an old lady, if I may say so. And in saying so, I would say that 50-something years ago, my mother had me in Port Harcourt by classical cesarean section. I'm sure the good doctor knows, and it went well. And you have doctors that could do that. The question is, it's not sometimes the drugs that you can't use as much as the fundamentals, the foundation of obstetrics itself. When I go, that is lacking, you know, right from before the babies are, I mean, women even become, or young girls become babies. In the North, for example, we have a lot of fistula problem because the young women marry very, very young. And sometimes we have a lot of, there is another issue now that you have, and that I foresee there, and that is where you have a lot of women who have contracted pelvics, and because of nutrition problem when they were growing up. They may look fat, they may look big, but their bony structures are inadequate. And what ends up happening is that with good intention, those of us who come from here, whether it's UNICEF or so, and we will give dried milk, dried egg yolk, and what have you got. And now you have a woman with small pelvic bones, and she's going to have an 8-pound baby because the baby is big, and she's in the village, or she's in the even if she's in the urban area, she's in the middle of God knows Jegunle or what have you got, which is like maybe several hours to a hospital, and she can't afford to get a private hospital to do a cesarean section. And we should pay attention to that. We should even going to India and doing work in the rural areas and up in the deserts. You work, it's not just a matter of the midwives. If they're educated well and know, you work with what you have. And sometimes we don't do that. You know, there's certain things, like certain areas when I go to work, you teach people how to deliver babies so you do not bleed a lot, you know, or you're talking about hypertension. There are several reasons. Bleeding is one of them. And hypertension, which is like preeclampsia, which is toxemia in pregnancy, that's another reason, because when the bleeding starts coming, You can't really stop it with little this, little that. You have to have a real tertiary care, like the doctor said. But how do you get there? How do we get our women to be, even if you're a farmer, you get your land well, you know, kind of well nourished and everything before it gets there. And if it doesn't,
So, Dr. Dorothy, you're saying that education among women is a key issue. That's what you're saying.
well, it's not just amongst women too. It's both. It's a health literacy thing. It's amongst the primary caregivers, the obstetric gynecologists that are the obstetricians that are there, or the perinatologists that are there, and especially the women themselves.
But then, Dr. Dorothy, Nigeria is one of those countries that has a lot of medical doctors overseas. So is it a problem of us not having the adequate personnel, or is it that we're not, is it that we don't have the personnel, the doctors, or that we don't have the right infrastructure? Is it about infrastructure or about, you know, having the right
well, let me answer that question. No. Going to Nigeria, I'll say that most of the doctors there that I see, some of the most brilliant minds that you will see, you know, Nigerians, they're bright people. Don't get me wrong. They are very bright people, but when you even if you're a butcher, if I don't give you the right knife, the right this thing, you won't be able to. And it doesn't matter how many times you read about something, if you don't practice it the right way, that's another this thing, you won't be able to do it.
Yeah.
And I've worked with some of the, you know, young doctors there and what have you got, and some of them are in the teaching hospital, for example. And when you don't have non-stress tests to help you, when you don't have airline to help you, when you don't have sonogram to help you, and you can't do, and you can't actually do a good fetal weight or BPD and things like that. And you know, it doesn't matter how bright you are. They have to be helped. And this is where the government comes into. They must give them the equipment that they need. But at the same time, they can't just wait. Sometimes I say in the hospitals to get this thing done. They have to go out into the villages and to the distance and educate those people. We have to have the 3 phases like they do in Asia also, where whether we like it or not, we don't have enough doctors, and most of our doctors do not want to go and work inside the villages where there are no electricity, there are no water, there are no this, there are no that. It's not fair to them. You know, they work hard, but at the same time, if we make the roads even passable, it will be like here, where we have.
Dr. Adinma, thank you, Dr. Dorothy. Dr. Adinma, I'm just wondering if you think that the government has any role to play in making it easier for women to have safe deliveries, and what are some of these roles that you would like to outline as a medical doctor?
The government has a lot of role to play. Fundamentally, you cannot move any health sector forward unless you build the capacity of the medical personnel you have. I don't think Nigeria does not have enough medical doctors. The problem we have is with the distribution of the available doctors and nurses. If you have to have doctors and nurses work in the rural areas without electricity, so water supply, then you have to give them extra incentives and motivation, allowances to be able to work there. And believe me, you will have some medical personnel that can work there. Now, the issue of funding is very, very fundamental to the health sector, because it is with funding that you'll be able to equip the hospitals and health facilities. It is with funding that you will be able to send the medical personnel to build their capacity towards modern healthcare practices. It is with funding that you can recruit enough staff, because you find that the School of Nursing brings out so many nurses, but they're not employed by government. They're all roaming about, and they've been poached by several other countries because of an embargo on employment that had been put in the 1988 Structural Adjustment Program of the Nigerian government, that embargo needs to be lifted so that we'll employ the nursing personnel that are roaming the streets and not performing. In fact, that is one of the reasons I'm applauding the National Primary Healthcare Development Agency for the new midwife services scheme that is now being employed to distribute nurse midwives to health facilities in the rural areas. I think we're going to see a tremendous improvement in the maternal mortality situation in Nigeria.
Dr.
So we need to
Adinma.
build capacity of the health workers towards family planning. Access to family planning is very, very important if we have to reduce maternal mortality. And we also have to build the capacity of the private sector. The private sector has not been harnessed. It is a tremendous, important sector of our healthcare system. And I think we should begin to harness the potentials of the private sector to be able to reduce maternal mortality. And government has to do that. Government has to release funds. You see, budgets are made, but I can tell you, release of the budget of the funding is very, very minimal. It's not commensurate with what is pronounced as the budget in the health sector. I mean, it's not enough to say you're budgeting this billion for healthcare and you're releasing only 1,000. It doesn't make sense. So these are some of the areas that government must look into. Government should not play lip service or politicize maternal health. That is very, very unfortunate, and that is what is happening in Nigeria.
Thank you, Dr. Adinma.
Politics going on in the health sector, maternal health.
Yeah, thank you, Dr. Adinma, for bringing up all this point, and I hope that some government officials are listening, and hopefully they would, take some of these advices that you are giving. Dr. Ogundu, I just want you to talk briefly about the importance of having healthcare in Nigeria, because I grew up in Nigeria. Growing up, I never knew anything about health insurance, all those stuff. I don't know, maybe they're having it now, but like when I was in Nigeria, there was no health insurance. It's either you pay or you don't get medical treatment at the hospital. And also nowadays, most people would rather do whatever they can in their power to go overseas to deliver their babies instead of having them in Nigeria just because of all these issues. Can you talk just briefly, because we're running out of time, about the importance of having healthcare plan in Nigeria?
Well, one of my mottos, I should say my adage in my practice is that health is a birthright. It is not a gift. It's not something anybody gives you. It is something that everybody should be entitled to, because it's the basic of being alive. And I think that it has come to the point where in Nigeria we've gotten to the point where primary education is universal, and they're actually pushing it secondary education, hopefully. And I think that health actually supersedes that. That you can only go to school if you're healthy. You can only work if you're healthy. And a vibrant community needs a vibrant individuals in there. And if the country that does not take care of that will be a very sick country, because it's going to rot from inside. And I think they should wake up and realize that. Otherwise, like the good doctor said, a lot of the professionals are going to just skimp out of the country and leave. And those of us who are here would just come, do some band-aid, this and leave those of them there without. But
so we do need healthcare plan. Like, this is not something that happens by accident. The government has to be deliberate about, having a plan to ensure the health of the people, especially mothers giving birth.
Well, right now, Nigeria has a health plan, and I call it a no-plan plan.
Okay.
So basically,
and when you have no plan, you're planning to fail. Is that right?
There you go. Because let's be honest. If that doctor is going to take his time to continue, and healthcare is something that evolves every day. There are new things coming out and everything, and they have to be on top of it. You have to give him the equipment that he needs. He can't have 19th century equipment to deal with 21st century problems, because we do have that kind of problems.
I really like the way you put it, 19th century problems. I have some medical friends here, doctor friends that studied here, and they wanted to give back. So they went to Nigeria trying to work. A lot of them like ran back in like a month. They said they couldn't deal with it because it's like having no equipment whatsoever. So Dr. Adinma, I just want you to talk briefly about the issue of blood transfusion. Apparently there's always lack of blood and also oxygen. What is going on? And also, is there any plan in place to help women that have lost a lot of blood and that need oxygen during delivery?
Yes, Nigeria has established the National Blood Transfusion Services. So we have centers in the 6 geopolitical zones where blood is pooled so that health facilities can access blood from them. The voluntary donation is going on, but it's not to the extent that we think that it should be.
Is that the only way, though? Is that the only way to get blood? Is it just by voluntary donation? Is that the only way to get blood in these hospitals?
Yes. Voluntary donations, and then relations of patients also donate blood. Some institutions also have policies. For instance, when I was at the University of Nigeria Teaching Hospital, the policy is that everyone that books, registers for antenatal clinic, gets a relation to donate at least 1 pint of blood. So you had a blood insurance, a blood bank insurance scheme, more or less, so that there's a pool of blood, so that in a situation where we may need about 13 pints of blood, it's there, easily available. So that is one of the measures. So the health facilities on their own take their own policies to make blood available. But then, many of the national blood transfusion centers are richly stocked with blood, and then health facilities can access blood from these centers. So blood is a problem, but it is being tackled headlong, and I think I want to congratulate the National Blood Transfusion Service for what they are doing. We could do more, but all the same, we're making a headway.
Yeah, Dr. Adinma, I appreciate when you congratulate this department and you talk about that we are making a headway, but to be honest, Dr. Adinma, I feel like it's not where we're supposed to be. I don't know if this is something that I mean, I'm glad that they're doing something and it should be commended, but I feel like at this time we shouldn't be at this level, being that we've had our independence for the past 50 years with the giants of Africa. I feel like Nigeria by now shouldn't be at that level. So hopefully they will step up their game and not just relax with where they are. So like I said, we're running out of time, but Dr. Ogundu, I just wanted you to talk briefly. Can you say just a little bit about the importance of family planning or spacing children? Does that have any role to play in the rate of maternal death, as well as the effect of having traditional health practices now that we have embraced the Western practice? And
well, I don't even agree. I don't agree. Just like in India, this and that, we should totally because even in this country we're going back to where you have dwellers and you're having
Dr. Ogundu,
home delivery.
Dr. Ogundu,